I wanted to talk about a recent article I saw, a legal recovery house that was being offered to patients in Florida, where patients after plastic surgery procedures were being sent to recover. It was set up as an assisted living facility illegally, and they were disposing of medical waste illegally, and there was 5 to 10 patients in the house at any one time, and lots of red flags here. So these recovery houses pose a real risk to patients if they are not staffed properly, if they're not properly vetted by the surgeons, and if they're not staffed by a licensed medical provider like a nurse who has experience. Ultimately, I don't endorse a recovery house for patients. So plastic surgery patients, if they're healthy enough for outpatient surgery, they should be healthy enough to go home. So where that changes for me, where I will place patients into a recovery hotel or recovery space, is patients that are traveling from out of town. So if you're traveling from out of town and you don't have family or friends that could check on you afterwards, take care of you afterwards, typically put you into a recovery hotel with a licensed practicing nurse, experienced in taking care of post-surgical patients, and they would stay with you and check on you minute to minute, hour to hour, and they're assigned one-to-one with patients. And these are typically for patients that have had a long surgery like a facelift surgery, tummy tuck surgery. I typically visit these patients at the recovery hotel or recovery space. I'll also do home visits if patients want to go to their home or a friend's home and have a nurse there. I'll come check, get a report from the nurse. The nurses can call me day or night. So these are ways that we keep it safe for our patients. But patients that are not safe for home or a hotel or a recovery house, they will typically be done in a hospital setting, because then they will be transferred from the operating room to a recovery room to a hospital bed, recover in a hospital for a night or two. The nurses are checking on them. There's monitors. If heaven forbid there was a problem, there's a full team of medical providers on site. But most plastic surgery patients, if healthy enough for elective plastic surgery, do not need to be managed in a hospital setting. Safety should be number one. The result is a close second. So always choose the safest option and then choose the option that could help you achieve your aesthetic goals second to that. Be careful about traveling for plastic surgery if they don't have a good recovery plan for you. Take care.